Ready to go?
Yeah, 1 second. Ready? Go.
Hi guys, this is Troy Naftzger, your host of Body Talk with the Advanced Spine Joint Wellness Center in Medina. This is going to be our first show, so it's pretty exciting. I got Michael Morris next to me here. Michael, thanks for being with us.
I'm excited because, number one, it's our first show, but second of all, Body Talk, that is such a great name for what we're going to do.
Little backdrop on that. I used to love a show. It was on NPR years ago, and it was Car Talk, and I loved Click and Clack. And as we started this, I thought Body Talk, what a great way to get folks interested in just talking about issues with their body.
Now, you were a guest on a show that we do in Columbus, and that's kind of what precipitated this show with you, because we couldn't get everything out in a 26-minute, 30-second show.
Sure.
So I said, you need your own, right? So why don't you kind of touch on who you are and what you do to start?
Absolutely. Sure. So my name's Troy Naftzger. I'm a wellness consultant. I'm a practitioner of functional medicine, and I'm also an orthopedic physician assistant. But what happened and what kind of drove this is about 8-9 years ago, I was working in orthopedic and reconstructive surgery here in Columbus. And I kind of burned out on that and ended up joining a wellness-based practice. And I was actually an employee and loved it, absolutely loved it. And then decided to open my own in Medina. And we opened there, and ever since it's been a lot of fun. And we've been just working on treating pain naturally, helping folks lose weight, help them balance hormones, and learn how to truly have health once again.
Now, the key is when you're talking about treating pain, it's not medicating to treat pain. It
Correct.
is actually treating the source of the problem.
That's correct. We're going to highlight that for sure, the source of the problem. I'm glad you said that, because it's going to be one of the things that we really highlight on the second show. This first show is going to be a general introduction to how do we look at things, what makes us unique and rare in the way that we do it. But the second show, we're going to talk a lot about that, finding the problem. Because one of the things that we're not so good at is actually treating the problem. In healthcare, what we're actually doing is just managing symptoms or managing a lab value.
Well, aren't you kind of, in a way, the way that medicine is set up right now, it is, there's no incentive for me to get you well. It is to keep you coming back. You've got insurance, use your premium, use your insurance to come see me, and let's just keep you going along, rather than if I cure you altogether, there's no need for me to be in business, right?
Sure. And I think you've probably all seen it lately. If you go on CNN, you might see that this little red pill. Have you heard about this?
Yeah.
So you see this little red pill and you read that and you go, I've seen that before, but we're all pretty quiet about it. So there were incentives for providers to actually prescribe this pill. And we're seeing it prescribed somewhat off-label in some of these articles that we're seeing, because the doctors were incentivized to do so. So the doctors do have some incentive to do certain things, use certain products, use certain medicines, and that's frustrating.
Well, it also leads to abuse, right? I mean, if you look at the opioid situation in this country, they were not it's a drug that's being abused, but it was used to treat pain.
Sure.
And now it's become this drug of choice because it's cheap. You can get a prescription for it.
Sure.
And those are the things. You don't use opioids in your clinic, right?
We actually don't prescribe. I'm a prescriber. We have a medical doctor. He's a prescriber and a nurse practitioner. None of us prescribe. So we've elected at this point not to prescribe because we don't believe that actually changes the problem.
Okay, but that's a very interesting thing, because you are a medical provider.
Correct.
And I'm sure that people come in and say, I'm just having knee pain or elbow pain.
Sure.
If I can just get a script filled, and your answer is, we're not going to do that.
We're not going to do that. It's not going to fix the problem. And that's a tough thing to educate people on. And we actually take a long time in doing so, hence the radio show. This has been a great way as we've looked at getting information out to patients, out to the public on, hey, there are other options. And we'll talk next show. I've got a fun analogy about other options and getting a second and a third opinion. But there are other options. There are other avenues. And my big quote that we're going to talk about next show, look again. If you've looked and you've looked for help, and maybe you are just getting medicines and it's not fixing the problem the way you thought it would, look again. If you're seeing some doctors, they're not helping, let's take another look.
Do you think that the basis of your practice has changed based on your background or the needs that you see in your community? And when I say that, you have a military background.
Sure.
So you're not some pushover. It's not some... I think when people look at holistic medicine, they think of people that are pushing the vegan thing and
Sure.
be healthy and all that kumbaya stuff. That's not who you are. You are really trying to dig deep into what a person's lifestyle is and heal them that way.
Sure,
right?
absolutely correct.
But you have to get a lot of information from these people to understand what their outcome is that they desire.
Absolutely. And it's not something that can just happen on a 20-minute conversation or a 30-minute conversation as an office visit. And a lot of patients will have maybe less than 17 seconds on average to tell a provider what their problem is before they get interrupted.
A regular doctor.
Correct.
Okay.
Yep. So if someone goes in to see their regular doctor, on average, studies have shown us they've got 17 seconds of talking before they're cut off. So it's not a conversation between two people. It's a very quick assumption about the most likely potential problem.
Well, can I interrupt you real quick?
Absolutely.
That number kind of astounds me because you got 17 seconds. That means to me there is already something in that doctor's head that's
Sure.
going to say, I got the perfect thing.
Right.
I'll just write it out right now.
Right.
You know, you can't sleep, I'll give you this.
Right.
You can't pay attention, I'll give you this.
Sure.
When they come to your practice, what do they get?
Well, they're going to get almost 4 days of an evaluation. And I know that seems outlandish.
Seems like a long time.
It's an evaluation with 2 doctors on 4 separate visits before we're probably going to start anything. So there's a lot of information gathering. There's a lot of conversation. There's a lot of listening. 90% of patients will actually tell us their problems if we were to give them more than 17 seconds. Now we're going to give them 30 or 45 minutes on the first visit.
Do you kind of treat it then like a first date? Because I'm not trying to be funny, but I mean, I'm thinking the first time you're with somebody, you want to know all about them.
Sure.
So it is a relationship that you're building with these patients. You are trying to get them to trust you, and they want to feel like you care about them.
Right.
That whole first date scenario, but they have to be honest with you.
Sure.
Right. Like if I hold back, and I don't tell you these medical conditions or what I want in the end, you can only provide me what I've given to you.
Correct. Right? Yeah, and that's a really good point. And do we have to treat it like a first date? I think that's a great analogy. I've never looked at it that way before, and it made me laugh a little bit. But it is a good way to look at it because you are meeting someone for the first time. And if I'm doing all the talking, if someone walks in and I know that their complaint is sciatica, okay, I can run down that road really, really quickly. But if this person's been to a lot of doctors prior to seeing me, that means we're probably either missing the diagnosis, or the treatment was incorrect, or it's just really darn stubborn. But it at least warrants a long conversation to see exactly what has the patient been through, what have they been experiencing, how did it start, what happened over the past 40 years that may have led to the problem that they didn't even think about. So requires a long, deep conversation to really figure out what are we going to do about this.
One of the things that happened here recently, we record a lot of shows here.
Uh-huh.
The guy who runs this station group, actually, he's limping around. And he said, I'm going to have a knee replacement. And Dr. Buzz was with us in
Sure.
the hallway. And you and Dr. Buzz are hand in hand. You treat people the same way.
Sure.
And he says, I have to get a knee replacement. That's all there is to it. Now, you know Dr. Buzz, and his thing was like, are you out of your mind? Like, you didn't even come to me for this situation. He's in intense pain, and he went to an MD who said, let's just go ahead and replace it. Okay? Do you get a lot of that in your practice where somebody says, my MD says not to do HRT or not to do stem cell treatment or any of that? When they get to you, is that the last line of defense? Like, I don't want to get cut on. I know I've heard that what you can do. Are they coming to you kind of like, I want to see what that last option is, or are they coming in educated?
It's really funny you asked this question. Years ago when we first opened, I really joked about changing the name of our practice, which is Advanced Spine Joint Wellness, to Last Stop Physical Medicine.
You put it like a neon light, like a gas station?
Right, and the reason being is patients would come in just at the end of their ropes with the problem. Some had maybe even already, and we still see this every day, maybe been through 2 or 3 surgeries, maybe on a lower back or a knee. Maybe they've been through some scopes or a recent knee replacement. We have a patient who just went through knee replacement surgery. I've actually developed a friendship with him. I've been to his house for dinner, went through knee replacement surgery, and he's not on the good side of the knee replacement. So he's really struggling. And despite all of our efforts to keep him away from doing that, he has not had a good outcome yet. And he may be listening, and Wade's a good friend of mine.
Hello, Wade.
Yeah. So, we wish him well, and we're still working with him. He's back with us, and he's trying to work through now what's been changed surgically, but we're doing our best to get him back up and functioning and back to life.
When you cut on something, though, it's never the same.
You can't change it. Once it's been cut on, you can't change it. And that's one of the things that we talk about a lot, and we talk to patients a lot about surgery, is surgery is always an option. It's always there. So there's no need to rush into it. You're always going to find a surgeon who's happy to do it.
Right.
They're all over the place.
They'll make time for you.
They're going to make time very quickly to do it for you. But the problem is once that's done, if you're on the other side of the outcome, and there are good surgical outcomes. We don't want to beat up on these guys. I'm friends with a lot of surgeons, and surgeons have their place, but the right time for the right thing. And what we do oftentimes nowadays is we rush into these things. And I'm just going to tell a little story, even though we've spun way off where I thought we'd go.
That's okay. That's how the show's, I think, going to go every week.
This is a great story because this was the catalyst to drive me out of surgical practice right here. I was working in Columbus. I'm not going to name the group or anything like this, but I was working in Columbus. And I worked in shoulder surgery. We were in complex shoulder reconstruction. We were kind of the quote-unquote best of the best, the last stop for reconstructions on a shoulder. And we had a fellow, he was a 34-year-old Indian male who had immigrated here, and his only complaint was pain right here in his biceps. If you're on Facebook Live, you can see I'm just pointing to my right bicep. It was his right bicep. Pain right here. Wasn't even that severe, maybe a 3 or 4 out of 10. And I really don't like pain scales, but it was relatively mild. So his first stop in to see someone, somehow he got scheduled with our spine surgeons. The first thing they did was fused his cervical spine.
So for a bicep injury.
For just biceps pain, was no injury. He just had pain in the biceps area. So his first treatment was this fusion. So now he's got plates and screws in his neck, and he's referred to us because he didn't improve. And one thing he had never tried, Michael, guess what he had never ever tried?
Rehabilitation.
Never had tried physical therapy. Not once. He had been through pain management.
It wasn't even recommended?
Not even recommended until he saw us. And we look, and I look at the surgeon, he looks at me, and we kind of go, okay, let's try some PT, for crying out loud. Hadn't even been through PT. So this fella had been through pain management. He had been fused. He had epidural steroid injections, all these things on his neck, but he had not been to physical therapy, which should be our first line treatment. I went through an orthopedic residency through the University of Nebraska, and the number one thing we used to do, and the number one thing we're taught, is PT. And there were some old school surgeons, really, really old school, who pioneered some of our things that we're doing, who said, listen, shoulders should have 1 year of physical therapy before surgery. Not 2 visits, not 4, not 2 weeks, but 1 year. So that's how far the pendulum has swung in our traditional healthcare system, that we see a guy with biceps pain gets his neck fused.
But is that part of the, I don't want to say the racket and crack it approach of medicine, where it is, I already know what the diagnosis is, I'm just waiting on you to tell me, the cart before the horse, because they could say, I've seen this before.
Sure.
So before if I've got 17 seconds with you before I make a diagnosis, that's wrong.
Right.
Because I know that I had, when I had to do physical therapy a few times, there was no injections, there was no rush to do anything. It was, here's the medicine ball, here's, doing the bands and all that. And I thought, what am I doing here? Like, isn't somebody supposed to address my neck issue? Problem being that part of the core was weakened from a car accident.
Uh-huh.
So I had to strengthen that before they even went to my neck or my shoulder or anything.
Sure.
But it's because they made me sit with them and tell them exactly what I went through.
Right.
Versus going to an MD, and this is not to bash MDs, I'm just saying in general, they always have the pill for what ails you.
Sure.
Right?
Yeah.
But they are not going to be able to spend the time that you will at a clinic walking them through rehab. If they've got questions, here's why. If they're in your building and they're on your floor, they have access to your people.
Sure. And just even highlighting a little bit more on rehab, even when folks get referred to rehab now, they become very frustrated. We have lots of patients. I would say 95% of our patients have come in. They've already been to physical therapy, but they're frustrated. And they're frustrated with PT, and the reason being is even our PT has gotten somewhat complacent. So someone goes to physical therapy and they're given, and this happened to me, and this was my personal experience. I was given 10 exercises, and I would just go in and I would do my 10 exercises. Someone would salute me from the corner, and I would kind of go, okay, no one touched me each visit. I just kind of went and did my 10 exercises. I'd look over and they'd go, you're all set. Okay. And I just sign out and off I went. So I was like, that's actually how I got into to actually working out, because I was like, well, I can just do this at a gym. So I got a gym membership. I was 18 years old. So mom gets me a gym membership, and I learned how to do my rehab on my own and ended up actually really getting into physical fitness. That was my introduction to actually exercising. And we hear a lot of patients that come in have the same experience. Nobody's touching them in physical therapy. We have physical therapists in our office, and they practice what's called the McKenzie method, which is 100% one-on-one, hands-on. So we actually overstaff our PT department to get hands-on people. So if they've been through,
they can kind of float between. So it's not you're assigned one person. You've got multiple people that are touching multiple patients, keeping it flowing.
Yeah, and typically during one visit, you're with one person the whole time. So for all 30 to 45 minutes, whatever is required, they've got one person who's familiar with them, and they're going to stick with them that whole visit, and it's fantastic.
Well, I had the same experience, because then I can give a shout out to Danielle. She may not have liked it at the beginning because I was so inflexible, and I just didn't enjoy it.
Sure.
But for the 11 weeks I was doing it, like, she went from seeing me not even able to sit regularly in a chair to I could run around, I could play ball again, and those kind of things. And it was really because she stayed on me the whole time.
Right.
But we had that one-on-one interaction versus, yeah, just walk around, do this 10-course thing, and then walk on out of here.
Yeah, and it makes a world of difference when you actually get hands-on people. Another story about, hands-off. We had a patient. We love treating migraine headaches, and we'll get into a lot of these things individually as the show continues. But we had a young lady. She had a headache, a severe headache for 182 days straight. So by the time she had seen it, 182 days straight, this headache just starts. She worked for a local school. She directed the kitchen and all the stuff for the kids to be able to eat. And she was busy, but 182 days straight, a severe headache. She had been admitted to the hospital for 5 days for them to figure out what this headache was. MRI scans, CT scans, PET scans, looking for cancers, tumors, everything. And didn't relieve the headache. She had been given IV morphine, Toradol, just every medicine under the sun.
She was given Toradol.
I mean, everything. I mean, any medicine you can think of, any scan you can think of having in 5 days, she was then discharged from the hospital with the headache still. So she finds us and she meets us and goes through this first hour of working with us and talking with us. And it was a lot of talking. And then we actually put our hands on her, did an exam, and said, listen, we're going to just have you come back a second day. It's kind of the way we do things here. We don't make snap decisions. We're going to meet as a group and discuss this thing. And she came back on the second day. But you know what she said brought her back for that second day? Yeah. We were the first people to ever put our hands on her. So in 182 days, we fixed her headaches within 2 weeks. If she's out there, I'd love to say her name. I can't because of HIPAA. But
she's probably listening really loud.
She very well may be.
Her head doesn't hurt.
Correct. But the reason she came back on day 2 is she said, you guys are the first people to ever touch me. I was in the hospital for 5 days, and guess what nobody did? Nobody touched her. So what's going on there? We were just relying on tests and all these things to try to establish a diagnosis, when all she simply had was a nerve pinched right behind her ear up here in the neck.
Wow.
And it just literally took 2 weeks to fix the thing. So a great story.
Yeah, that's awesome. We have to take a break here because we've been going almost 19 minutes, but we will be right back on Body Talk.
19 minutes, holy cow.
I told you, dude.
Yeah, that was flowing.
It's really kicking
I
ass.
was like,
yeah,
didn't even realize it was that long. Like,
yeah.
Who stole my coffee?
So I was listening to one of Buzz's, I was going on his website and I was listening to some of his shows. And what I liked is that he recorded some of his own commercials to throw in there. Mm-hmm. He had one for like tea and, a couple other ones. I was like, that's great.
We'll do the same thing.
Okay, good.
We were talking about the commercials before we came back because we were doing the hightail thing. Here's where our next step is talking to your people up there. They can put their commercials in your show.
Yeah, exactly. Yeah. Right, yeah.
Because
it makes sense. It only makes sense. I mean,
well, it's like a podcast.
Yeah, sure.
It lives on beyond just it aired one time.
Yeah.
So,
right, either that or they send. Yeah, I'm not sure how we.
For this one, we'll just probably put.
I'll throw yours in there that you.
Yeah.
Right.
Yeah. Okay.
A couple other ones that we
Sure.
just have no choice but to do for this time.
Right.
But,
Sure.
If you want to keep talking, we can go longer, and we don't need as many commercials.
If we can go another we can easily go 7 more minutes, 8 more minutes.
I'd say it's going to go by awful fast.
Yeah.
Yeah.
And then I don't have to put a lot of commercials.
There's no idea when it's...
Okay, I got you. That makes sense.
Yeah. So if we could probably put like, you know, a couple commercials in, maybe 3 or 4 at the most.
Mm-hmm.
You know, we've got the one that Jim does, the one that you do. We can put that there.
Sure.
And then put it at the end, and we're fine.
Okay.
So let's just keep talking, and then where do you want to go from here?
Well, from here, gosh, I mean, we've gone all over the place.
I know, but don't feel like it's not a roadmap.
Yeah.
It is literally, we got to keep concentrating on you, though.
Yeah.
Like what you do, because the next show is going to be pain management.
Sure.
You know, what you're eating and putting in the body.
Sure.
So let's cap off on you. Like,
Okay.
So what I'm going to do is I want to get into what you want to do, like why you're doing what you're doing.
Sure. Okay.
All right. So
Okay.
you bring us back.
Okay.
They're listening to Body Talk.
Yep.
Introduce you.
Yep.
Introduce me again.
Yep.
Good. All right. Ready?
Hey guys, Troy Naftzger here with Body Talk with the Advanced Spine Joint Wellness Center. If you want some information on us, you can check us out at www.ohiopain.com. I'm here with Michael Morris, who's helping us create this show. Michael, again, thank you for being here.
No, this is cool. I wanted to get people, if you were watching on Facebook Live, you just heard me spill the beans on what we're going to talk about. But I think the important thing also is we've talked about the methods of advanced spine. I want to know what you, Troy, personally, this is your business, right?
Sure. Mm-hmm.
Where is it you want this to go? Because everybody has their theories when they own a company, and especially when it comes to treating patients. But why are you doing what you're doing?
Yeah, I'm doing what I'm doing because I really, really believe that our healthcare system is way off track. We've really gotten so far off track that we really don't even know what the definition of health is anymore. And I, again, have a personal experience with how that occurred. So my drive for this office is to continue to grow a practice that can let people come in a non-confrontational setting, feel that they get the best shake when they come in for these 3-4 visits initially to really evaluate what their problem is and the best possible shot at improving their health for the remainder of their life, whatever that is that God's got for them, to give them the best possible shot to continue to live their life as healthy, as functional, as active as they can. That's really the drive and where I want this thing to go. Now, how big or how small does it get? 7 years ago, I actually expanded to 7 offices throughout Northeast Ohio with a partner of mine. We have an office down in Nashville, Tennessee. I don't see practice expansion in my future, but what I see for this Medina office, which has just grown considerably in the 4 years we've existed, is continuing to vet and create services for patients that have absolutely no side effects, yet will continue to kind of fill in some of the gaps that we see to help people live and learn to heal in the way that their body has the potential to do.
Don't you think it's amazing the things that are out there when we talk about, and we will talk about this in future shows, when it's weight loss, HRT, PRP, stem cells.
Sure.
All the things that are out there, and Buzz, and again, I bring him up just because he's a good buddy of both of ours, and for 2 years I've had to hear these lectures in my ear. When he talks about bioidenticals and these things where there's not a lot of money to be made by getting people to do them.
Sure.
Though they will change the course of your health.
That's
they
correct.
will improve it and extend it, and regenerative medicine is the next big thing. However, you're not going to get that from your regular MD.
You certainly won't, and you certainly won't get your insurance to cover it as well.
Yeah, insurance.
Insurance.
We're not going to hammer that today, but
No, we are going to get into it. But that's one of the interesting things. One of the things we're really going to highlight on this show is nutrition, weight loss, these kind of things, and we'll get into that in a few. But no insurance at this point covers a nutrition program, meaning for me to take all the time with my staff to go and create a program for an individual. For me to sit down and talk for 30 minutes, they have a consult now. Like Obamacare did that. That's great. It gave us 30 minutes to sit down and talk. That's good. But when it comes down to the application, no coverage. And why is that? There's no money to be made off of it for an insurance company.
Is it there's no money to be made off of people getting healthy? I've heard that said before.
Sure.
Because honestly, there's not. If you look at the amount of medications, if you're watching any TV show during the day, and God love you if you're watching TV during the day, because every single thing has a pill out there.
Yeah.
And the warning label, not warning label, the
list of side effects.
The disclaimer on
Yeah.
the thing. It's a 30-second spot, and 18 seconds is if you plan to walk, get in a balloon, walk a dog. it's such horrible side effects.
Yeah.
But on the picture, it's somebody smiling like, I got my life back again.
Sure, they know how to market to individuals, and they know that we're having problems, and some people get relatively desperate, or they just want the help that they can, and these pharmaceutical companies have millions of dollars to market to us. Buzz and myself and these other small practices, I'll actually be with 20 other practices in Charlotte this weekend at a conference. We don't have that kind of budget.
Right.
So we're using these kind of avenues to reach people and say, hey, just like we're going to talk about next time, look again. Okay,
right.
If you found one of these medicines, and it's not doing what it's supposed to, look again. There's a lot of ways to look.
It seems like there's a lot of medications out there that almost like dull the pain or dull the senses to. You're not eradicating the problem.
Sure.
You are maintaining. I'm trying to think of the way to say. You are going down the same course. You just don't feel the side effects as much.
Well, we get this a lot. Let's talk about diabetics, for instance. I have a lot of patients that come in, and I'll ask them about their past medical history. Are you diabetic? No. Do you have high blood pressure? No. And I look down at their medication list, and they have medicines for high blood pressure and for diabetes. And a lot of patients think because they're on those that they're not diabetic or that they don't have high blood pressure, but you do. All we're doing is managing a number, and in many cases, poorly. There are many poorly controlled diabetics out there because what's the number one thing we've never fixed? And that's what they're eating. Right. And we have a diabetes reversal program. This will be a whole program in itself, a whole show in itself.
I've seen this thing, and it makes so much sense, and yet I can't believe that. I almost said I can't believe you came up with it or Buzz, but to have somebody show it to me, and it's not, you can't Google it and find
right.
this thing.
Sure.
It's not on the healthcare website. Everybody's so worried about their health insurance.
Sure.
But they're not looking for this program.
I have a young lady just the other day who looked at the nutrition program, and she goes, gosh, it's not covered by my insurance. But right now I'm spending over $500 a month on diabetes medicines. And I looked at her and I said, in less than 4 to 6 weeks, I can have you off those medicines for half the cost.
Right.
So it was a no-brainer.
Well, and probably cut down on it wouldn't cut down on your grocery bill, because if you want to eat healthy in this
sure.
country, it costs like 3 times the amount. However, getting rid of diabetes should be probably higher on your list than buying Cheez-Its.
And this is my take on diabetes. I'm not going to go too far on this one. I'm going to save it for another show. But every single diabetic will develop a diabetes complication, even on medicines. Every single one.
It gets deeper, right? So it's not, if you have diabetes, you can manage it, but you're still going to develop more symptoms off of it.
Absolutely. Absolutely. They're all going to develop diabetic neuropathy. They're all going to develop high blood pressure. They're all going to develop kidney problems, eye problems, vision problems, blindness. Everybody, even medicines. No matter what medicine they're on, we end up managing the complications down the road as well with more medicine.
Symptoms.
We are managing a disease, and now we're making it a long, slow march to the end, in my opinion. And I know that sounds kind of grim, but it is. And there are ways to reverse the course of this disease, and it's a heck of a lot of fun.
So when you are having that first conversation with somebody, and you say, I can help you reverse this.
Sure.
What is the look on their face has to kind of go blank, or like, this guy doesn't know what he's talking about.
It's funny. A lot of patients have found that program somewhere, or heard us lecture or talk, or seen maybe something on Facebook or Google about this program. So some of them come in and inquisitive and go, seriously, you can get me off of insulin? And the answer is always yes. And we have a video right on our Facebook page. You can go right to Facebook, Advanced Spine, Joint, and Wellness. There's a video right there, live testimonial from a patient who was off insulin. He was on 42 units of insulin a day. In 3 weeks, he was off insulin.
Wow.
Yeah. And he had lost 40 pounds in 3 weeks.
How did he find you?
He found us. He actually came in for lower back pain. He was a sheriff's deputy in Medina. Severe lower back pain. Interesting story, too. 30 years of lower back pain. All the other doctors told him they couldn't help. Been through surgery. We can't help you.
These
pain
are actual
management.
Doctors. This isn't wellness people. These
Nope.
are doctors.
These are doctors, surgeons, medical doctors, DOs. These are traditional physicians and surgeons who told him 30 years of lower back pain. You just got to live with it. Well, we got rid of his back pain completely, and he was off of his diabetes medicines. And he went into the diabetes program because we had earned that trust with him. We had, gotten rid of that lower back pain, earned his trust, and then said, hey, Mike, there's a solution for your diabetes too. And lo and behold, 4 weeks later, he's off of medicines. So
I'm sure the word of mouth, he probably told all of his other buddies.
you
Like,
can't stop the people coming in from him, and he's still out there, and he still comes in every now and then just to say hello. So fun guy.
that's cool.
Yeah. I think we're about out of time.
We are about out of time, but we will have all of these shows will be on Facebook Live, your YouTube channel,
Correct.
your website. So I say we take a break now and we bring them something back next week.
Sounds good. And if they want to find us, www.ohiopain.com, easiest way to find us, and you can find all the links from there.
Cool.
All right, till next week. Yeah, good.
You're a natural, man.
Thank you. Oh, you mean him.
Oh, yeah. Let me just.
Oh, no.